Good afternoon. I'm Jeff Birdwell, Director of the Huntsville-Madison County Emergency Management Agency. It is Wednesday, November 10th. On behalf of Mayor Tommy Battle, Mayor Paul Finley, Commission Chairman Dale Strong, Huntsville-area government, healthcare, and our emergency response agencies, we bring you this briefing on our community's response to COVID-19. Our speakers today will be Dr. Pam Hudson, CEO, CEO, Crestwood Medical Center, and Dr. Aruna, neurologist and president of the Madison County Medical Society. Before we go to our speakers, I'll give you the current numbers. In Alabama, there are 837,428 cases of COVID-19. In Madison County, 52,830 cases, having resulted in 722 deaths. Current positivity rate for Madison County is 4.6%. At this point, we'll go to our first speaker, Dr. Pam Hudson, Crestwood Medical Center.
Thank you, Jeff, and good afternoon, everybody. It's a privilege to represent our hospitals in our community as we respond to the pandemic and also respond to the challenges of keeping our health community safe. Today we have 37 inpatients in the combined hospitals in Madison County. 9 of those are in the intensive care unit and 7 are on ventilators. As Jeff already mentioned, the transmission rate or the positivity rate that we're seeing is about 4% in our community. So this is good news for our healthcare teams, certainly, but it is still a virus that we need to be concerned about, and vaccination is really the key to interrupting COVID's evil ways among our population. Some models are predicting a surge after the holidays, after Christmas, and that is likely to hit in areas where there are low vaccination rates, so areas that have a greater vulnerable population to spread the virus and infect more people. So vaccination is still important. As you know, the pediatric vaccine was approved for ages 5 to 11 and is available in our community. I'm aware that some of the pharmacies have it. Huntsville Hospital should have it by tomorrow, and ADPH also has a vaccine, and Huntsville Pediatric Associates has already started vaccinating. So good news on that front. And then also, it is important to get boosters. If you are previously vaccinated, please be sure to get the booster when it's time, approximately 6 months after your last of the series of the first 2. And the reason that's important is that there will be surges coming in the future. This virus is not done with us yet, and as the further you are out from the primary doses, the more your immunity wanes a bit. And also for those of our community members who got COVID and actually experienced the illness, you are not immune typically to the level that would keep you from getting infected again. You may have a less severe course, but vaccination is still recommended for everyone. So please get the facts and get vaccinated. But if you're not going to vaccinate or you cannot vaccinate, then please adhere to the masking and be careful about indoor crowds, and certainly the cautions of all the holiday travels from other areas that may be hotter spots than we have been, so that you can keep yourselves and your family members safe. Hospitals are and must continue to require masks and have visiting restrictions. We are governed by CDC and the Medicare, Medicaid rules and regulations from the federal level, so you will see in the hospitals there's still 100% masking, and while we have loosened our visiting restrictions, thankfully, there are still some restrictions, but they're much more like what you would see in a normal flu outbreak in the middle of winter, so nothing beyond the safety measures that we have been taking with some additional glass barriers and that sort of thing. But just so you know what to expect when you come to the hospital, and I wish everybody a good, safe holiday.
Thank you, Dr. Hudson. Now we'll go to Dr. Arora, from the president of Madison County Medical Society.
Hi, I am here representing community physicians. I've been here before. I'm on my way out as a president for the county, still president for our state. And today I really want to resonate a message of our doctors, trying to keep public health in mind. We recently had a board meeting a few days ago, and we had a very frank, honest discussion about where we are in this pandemic. We don't want to get too excited that we're at the point of this becoming an endemic, because, you know, while there are some great officials who have said that, Scott Gottlieb among one, we're not quite there yet, as we are a lower vaccinated region in the country. And so, like Dr. Hudson said, as we approach the holidays and as we see what's happening in the UK, which is, you know, some of the data always comes out, thankfully, a few weeks or months before we get affected. And so we still want to be vigilant. We want to do what's correct. We want to use common sense. If I can leave with some common sense messages going forward, I would say we have been patiently sacrificing for 2 years now, almost, and we just ask you to use your common sense. Think back on all the advice that we've been giving you at all these briefings, and the most important thing that you could do so you could continue to live your life and socialize and be part of a community is really just get vaccinated. You know, the first 2 doses of vaccine, if you have not been vaccinated, that is really the best thing that we could do. Children are now eligible under the age of 12, 5 to 11-year-olds can be vaccinated. The vaccine is safe and effective in that group. I have several pediatric physician mothers who have rushed out and gotten their vaccines for the children over the weekend and in the last few days. They're the ones taking care of these children who've come through, you know, with COVID, whether it's been in the outpatient setting or if it's been in the hospital setting. Most of the times children do well, but there are times where children have long COVID symptoms and deal with some of the complications that we don't necessarily pay so much attention to. So the easiest thing that you could do is simply give the safe and effective vaccine. Vaccines have been given to, so many people throughout the world. The side effects that usually come across when you have a vaccine is in the first 2 months, and now we have billions of people all over the world who've been vaccinated, and we just haven't seen that yet. So I strongly urge you to be vaccinated. If you've had COVID, I'm here to tell you there is obviously natural immunity is a thing. You can't bank on the natural immunity and your antibodies to be at that constant level of protection. So, you know, please do get vaccinated. You know, you'll just be a super immune person to the COVID virus if you were to see it again. And this virus will see all of us again. You know, once it does become endemic, we're all going to touch this virus at some point. So wouldn't you want to have your best defense forward? And I know we as a city, we as a county are ready to just move on and live life and see the smiles on everybody's beautiful faces as we come together. But just remember, over the holidays, be safe, be sensible, don't put your vulnerable family members at risk, but do continue to live your life. We do have to consider off-ramping. Thank you.
Thank you, Dr. Arora. And thank you for watching today. Our next scheduled briefing is next Wednesday, November 17th at noon. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. As always, as you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
Good afternoon, Dallas Parker with News 19. My questions are for Dr. Hudson. You mentioned CMS mandates. What is that going to look like in Crestwood's case? Are you afraid people won't get it and will leave? Or like, what is that going to look like for your hospital?
Well, Dallas, I assume you're talking about employees.
Yes.
Yeah. We are fortunate that in our workforce, we're about 75% vaccinated. So that actually came out this summer with the healthcare worker mandate, if you will. And so we also engaged with surveillance testing for the small number of folks that are in our workforce who had chosen not to get vaccinated. So with this new set of regulations, we'll just be doing some fine tuning. I am not anticipating a huge issue with that, and I think that most businesses will find their way through this. So I'm always worried about everything, but I think that our employees are at a good place.
Gotcha. And just following up on that, I was reading that facilities are going to be required to come up with some sort of contingency plan for those who are medically or religiously exempt from that. What is that going to look like for you all?
Well, we already have a contingency plan in place, and that is the frequent testing. And that's also written into the regulations both from under OSHA and under the CMS or the Medicare, Medicaid guidance that we have. So, again, there's a lot of legal action going on, so you don't exactly know where things are going to end up. But at the end of the day, it's our obligation to do what's safe for our workers and safe, most of all, for our patients, so that we can continue to serve them and continue to be a solid healthcare team.
Perfect. Thank you.
Alex Torres-Perez, Way 31 News. So we were talking a little bit about the mandates, specifically the OSHA mandate. I know that with the new state laws that were passed last week, it kind of puts businesses right in the middle of whether they should require vaccinations or not. You know, what message do you have for these businesses who are currently stuck in the middle?
Is that a question for me? Was that directed at me?
For either one of you, honestly, just to get a physician's perspective on this.
Sure. I guess my common sense advice, for any business would really be just to encourage protecting the health of the people that work with that business, So really, if there's anything that we can do as a community, as doctors, to help those businesses to provide information correctly for their employees to make their choice in getting a vaccine, which we know is safe and effective.
Sorry, I have to go back and forth. So you mentioned the pediatric vaccine might be available for kids, younger kids, starting tomorrow at Huntsville Hospital. Have you gotten a lot of response already, booking-wise?
Well, earlier on the community call that we had, still not every place is offering the pediatric vaccine, and I would expect that a good answer to your question will be more apparent within the next several days. So some places have only had it for a day or two. It's my understanding that Huntsville Hospital's vaccine program they haven't had it, but are expecting to be able to start tomorrow. So really, it's too early to tell.
Just to add to that, I did speak with Dr. Landers, and it looks like the 2,400 doses will reach Huntsville Hospital today or have already reached, and I think there will be a press release, and I'm sure Huntsville Hospital will also comment.
And for your viewers and listeners, ADPH also is offering it, and it's available there as well.
All right, at this point, we'll end this briefing. Thank you for coming.